Any man can get prostate cancer. In fact, 1 in 8 men will be diagnosed during his lifetime, and protected is nobody, not even the President of the United States. Joe Biden himself was diagnosed with an aggressive form of prostate cancer. But here's the good news. If prostate cancer is caught early, while still confined to the prostate, the cure rate is extremely high, almost 95%. But in late stages, the cure rate drops sharply, and the disease becomes lethal. That's why I'll show you how to spot prostate cancer early, what treatments are available, and what your prognosis might be. The prostate is a small organ, just below the bladder, and in front of the rectum. You can imagine it as a small muscle wrapped around the urethra, the tube that carries urine out of the body. Women do not have a prostate. It's unique to men. The prostate produces prostate fluid. This fluid mixes with sperm from the testicles to form semen. The exact cause of prostate cancer isn't fully understood, but age is the strongest risk factor. Prostate cancer before 40 is extremely rare. After 50, the risk rises sharply. Most diagnoses occur after 65. Family history is also important. If your father or brother had prostate cancer, your risk doubles. Prostate cancer is more common and often more aggressive in black men. Other factors like high-fat diets, obesity, and genetic mutations may play a role, but they matter less than age and family history. The main issue is that prostate cancer has no symptoms in its early stages, but when symptoms do appear, they include frequent urination, especially at night. This happens because the growing tumor presses against the urethra, making urine flow difficult. The bladder becomes more sensitive, signaling you to urinate frequently, even when it's not full. You might also have difficulty starting urination, a weak urine stream, trouble fully emptying your bladder, or pain and burning during urination. These symptoms occur because cancer can irritate the urethra or bladder lining, causing inflammation and discomfort. Blood in urine or semen is possible, but rare, especially in early stages. These symptoms aren't specific to cancer. They can also come from benign prostatic hyperplasia, or BPH, which is simply an enlarged prostate. BPH doesn't increase cancer risk. The two conditions often coexist in older men, but BPH itself never turns into cancer. Most prostate cancers depend on testosterone to grow. Cancer cells use testosterone as fuel. Advanced treatments, therefore, often aim to lower testosterone levels, known as androgen deprivation therapy. But here's a paradox. If testosterone drives prostate growth, why don't young men with the highest testosterone get prostate cancer? The answer lies in age and cell mutations. Young men have healthier cells, fewer genetic mutations, and less DNA damage. As we age, these tiny DNA errors build up. Eventually, these damaged cells become cancerous, and testosterone acts as their fuel. The first step in suspecting prostate cancer is the prostate-specific antigen, or PSA, blood test. It is recommended screening test for most men after 50. For high-risk groups like Africans and HISON with relatives with prostate cancer, screening starting age is before 45 on NX20. High levels of PSA suspects prostate cancer. This test has high sensitivity, meaning if cancer is present, levels are elevated in about 93% of cases. But the test also has false positives. Elevations can occur from infections or enlarged prostate. Digital rectal examination is commonly combined with the PSA test. Together, these tests have high accuracy. Cancer often appears as hard lumps or irregular areas. Ultrasound through the rectum can be helpful but is less commonly used. Abdominal ultrasound isn't effective for detecting prostate cancer. MRI and rectal ultrasound are more accurate, but biopsy is necessary for a definitive diagnosis. Differentiating prostate cancer from benign hyperplasia is challenging, especially since about 50% of men over 50 have BPH, while lifetime cancer risk is about 12%. These two conditions frequently coexist. In fact, nearly 30% of men with BPH also have prostate cancer. The aggressiveness of prostate cancer is measured by the Gleason score, ranging from 6, less aggressive, to 10, highly aggressive. This is based on how cancer cells appear under a microscope. Fortunately, most prostate cancers aren't aggressive. About 70 to 80%, especially those caught through screening, are low to intermediate grade. Gleason score less than 6 out of 10. From initial cell mutation to detectable prostate cancer takes roughly 10 to 15 years. Metastasis can take several more years. Some low-grade cancers never metastasize at all. Men with slow-growing, low-risk cancer often live normal lives and pass away from other causes. Average survival exceeds 15 years. However, aggressive metastatic prostate cancer typically shortens survival to about 3 to 5 years, even with modern treatments. Treatment depends on cancer stage, grade, and overall health. For early, slow-growing cancer, active surveillance may be enough, meaning close monitoring with regular tests. Many low-risk cancers never require active treatment. Radical prostatectomy, complete prostate removal, is often curative for localized cancer, with cure rates around 90 to 95%. Radiation therapy, external beams or radioactive seeds, has similar cure rates. Hormone therapy reduces testosterone levels, slowing cancer growth. It's mainly for advanced cases, not curative, but controls cancer for years. Chemotherapy, targeted therapy, and immunotherapy are used primarily for aggressive metastatic cancers. They extend life, but don't cure. Initially, around 80 to 90% of metastatic prostate cancers respond to androgen deprivation therapy, but eventually, cancer cells adapt and treatments become less effective. Preventing prostate cancer entirely isn't possible, but obesity raises the risk of aggressive forms. Eating more fruits and vegetables, less fat, regular exercise, and avoiding smoking can significantly lower your risk. Early detection is critical. Knowledge is power. Awareness can save lives. Let us not wait until it is too late. Let us act now for our health, our future. Our lives depend on it.